Doctor, first of all, I can't thank you enough for all the strength and your presence that has helped our family when we needed you most. Truly, truly grateful, and that we will, I mean, there are no words that can express that. It still puts a, makes my skin tingle. Honestly, you really are very, very, very special to us. Reading your book about the holistic approach to the value of life makes me ask one simple question. And I was just wondering whether any work is being done in this area. I mean, I'm just really curious about this, that we all, cancer is such a dreaded word. What can you tell us, Doc, on how to, I mean, your statistic, you said 1 in every 2 men, 1 in every three women. How does one avoid it? Is this unavoidable, or, I mean, is this like a noose around our necks? Is any research being done on perhaps how we can get away from it rather than try to treat it after it's manifested?
Well, that's a very interesting question. And would I deflect that to Dr Patel, because she probably is a lot more in that preventive side as well. So I just want to deflect that to her and see what her perspective of, please, Deborah, go ahead.
Yeah, so it's a great question, actually. And I would say I'll channel one of the America's founding fathers, Benjamin Franklin, to echo your sentiment that an ounce of prevention is worth a pound of cure. That's something we say a lot in cancer. And it's true, cancer is something that will happen, it's related to aging. And so it happens more commonly as we get older. So it's become a more common disease as cardiologists have gotten better at treating heart disease and preventing coronary artery disease. So as we have a population that's aging, cancer we see more frequently. But prevention is really important. So making sure that you're making healthy choices, like exercise, a healthy diet, wellness, like Kashyap talks to us about all the time. And then also making sure that you're having appropriate screening. Things like mammography, cervical cancer screening, prostate cancer screening, colon and lung cancer screening, really important at causing an earlier diagnosis where possibly just surgery is curative as opposed to surgery and chemotherapy and radiation and possibly having a higher mortality. It's actually been a great challenge during coronavirus when we've seen that a lot of preventative behaviors like screening for cancer has gone down quite a bit because we know that we're missing some early cancers. But yes, to your question, there's a lot of research and a lot that one can do to reduce your risk. The challenge that's there is that even if you make perfect choices, you still could get cancer.
Wow. So what's the next step forward? I mean, the pharmaceutical and the medicine industry has made such incredible strides. Do you think there's a breakthrough and one day we can look at cancer like perhaps just like measles or chickenpox? I mean, do you think that day will come?
I do. I will defer to Kashyap too, but yes, there are strategies looking at prevention, looking to identify individuals at high risk that have been incredible. And also, we are understanding better how to make cancer a chronic disease. And so, Kashyap spoke about when someone asked him that, cancer really is our cells, and we have to think about how our body can make a peaceful coexistence with them. If we discover cancer and prevent it from growing, but it continues to exist in the body in a chronic way, but won't kill you, that's okay. And so I'll say many cancer treatments are geared towards that philosophy, that if we can treat it like a chronic disease, like one would hypertension or diabetes, that would be favorable.
Great. Thank you so much.